Hi, I'm Susie Morgan, founder and director of training at Precision EMDR Academy. And I am just so glad that you are joining us today because we are with Dr. Colette Lord, and she is one of our team members. She's also the director of professional credentialing for Precision EMDR Academy. And so she is going to be talking about her experience that I think so many of you will relate to. Or if you haven't yet, you will relate to at some point as you become trained in EMDR or become an experienced EMDR therapist. And that is realizing that dissociative disorders are a really critical thing to know about. And there is a spectrum of dissociative symptoms. And when we are working with EMDR, because of the way EMDR works in the brain, we have to know what we're doing in terms of screening for dissociation and ideally learning how to treat it in its various forms because we can do incredible things. So let's get started. I want to introduce Colette to you, or actually have her introduce herself and her experience, a little bit about her resume. So Colette, tell us about you.
As Susie said, my name is Dr. Colette Lord. My pronouns are she, her, and hers. And currently I'm working in private practice in San Diego, California, which is pretty much the general location where I've done all of my work. But I started doing this work when I first got out of grad school, working in community mental health. I did a lot of work with Medi-Cal clients, Medicaid clients, people who were really complex with a lot of needs. And so, of course, I was working with trauma from the get-go, right? And in really, difficult situations. And then I got trained in EMDR in about 2014, and that really kind of just changed the complete way that I operated because, of course, EMDR is such a powerful tool. But I then was able to kind of learn how to try to navigate using EMDR in community mental health, which is a very different experience from using EMDR in private practice like I do now. But again, it was these complex cases have always been where my interest lie, where my strength has fortunately been. And so I really cut my teeth in doing the work with folks there. And then I decided for myself, I needed to get out of that world to kind of preserve myself. And so I went into private practice, but I'm still working with Medi-Cal and Medicaid clients. And then I have, my fee-for-service clients as well. But I've really continued to focus on EMDR with complex trauma, dissociative identity disorder. And then I've also been doing a lot of work in the last 10, 15 years with the trans and non-binary communities. And of course, there's a ton of overlap in all of that. But that's really where my passion has been. That's a little bit about me and where I come from in this work.
And I remember I was your consultant way
Yep.
back in the day when you were an early EMDR therapist. And I remember it being the case that we could barely even talk about standard protocol because of the level of complexity of your cases.
Yeah.
At the, so so let's
Yes.
talk about this, how
Okay.
you really became aware that dissociation was something you needed to learn more about. And really, why I think this story is so important is because I do think people who are listening will have had similar experiences. So tell us yours.
Yeah, absolutely. And I could not agree more that this is something that I hear a lot of others sharing the experience of. But, despite the fact that I had been doing trauma work for a good 10 years when I went and got trained in EMDR, no one ever told me to look for or to expect that I could possibly ever see someone with dissociative identity disorder. It just didn't register. So I went through basic training, I came out, and I believe since we were working together, you had recommended that I screen with the multidimensional inventory of dissociation and not just the DES2. And I I gave that to a couple of clients and I found that I was already working with two clients with DID. And I'm going to just be so vulnerable right now because when I look back, I want to just kind of smack my head and be like, oh wow, because one of those clients was such just a, if you could have cut the DSM out into a person describing DID, that was her. She at her intake told me that there was I don't remember the words she used, maybe personality that she had that had another name, that she didn't remember what happened when that person was out, and that, friends had shown her video of her being this to actually prove to her that no, this really does happen. And that is, it just never occurred to me in the assessment that I could be looking at someone with DID. And it's so, once I got trained to start looking for it, it was so obvious, painfully obvious.
So how is this? You have a PhD. So how is this that it took all the way until then in your career? Because you weren't even a baby therapist.
No.
That to be something that was on your radar. Let's talk a little bit about like why you think that is, but also just like what was your experience directly with it sort of just not being a part of what was on your radar, despite it being in the DSM.
Yeah, yeah, absolutely. I looked back and I tried to remember when I went through grad school, in my abnormal psych class. I don't remember if they talked about it as a diagnosis,
Mhm.
even. It certainly was never, none of the consultation or supervision I ever got when talking about my cases ever had that. There was kind of this either a dismissive, well, that's just really someone with borderline kind of, being all extra, or this like, oh, well, it is a thing, but it's so unusual and you have to go through, all of this like brain imaging and you have to go off to like LA to have it assessed to even know and verify that it was a thing. So you'll never really see that in practice. Were the kind of two extremes of the culture that I came from. I don't remember anyone ever talking to me about it. And then when I went through the training in EMDR and started recognizing that this was coming along, and I looked up percentages, prevalence rates in the DSM, it is more prevalent than schizophrenia, than OCD. And yet we talk about it like it's this, one in a million experience when it's not. And that is something that really, kind of fires me up. And I just, I had a lot of pushback in my work with colleagues, from with that kind of, you know, these kind of smirking comments of, wow, you really just seem to see this everywhere now. Not like, oh my gosh, I'm so glad you're starting to recognize this thing that's going on for our clients, but kind of this dismissive, you're one of those, you're one of those people kind of responses.
Mm.
Um, I had a psychiatrist tell me, okay, well, maybe that's going on for this client that we shared. I had let him know. And he's like, but, I really do think she's psychotic too because she hears voices. And it's like, we're missing, there's this, I really believe there's a parallel process of dissociative not knowing that goes on in the psychology and the mental health field, that where we don't want to know and we can't make the connections because it can be so obvious like that, and yet we're still missing it or denying it.
It's just there's like I'm going to explain what I'm seeing symptomatically any other way, but this
Hmm.
is a dissociative disorder, despite the stats, despite the fact that it has been legitimized. And there's things just, kind of commercial for your training that you talk about in the training about very real brain studies, things like that, that we, not that we need those to diagnose it, but we have those now to say this is a real phenomenon that is not just somebody, overdiagnosing, like was the attitude, but really something
Yeah,
that we need to be able to see and have eyes to see and not just be automatically dismissing what we're seeing and ascribing it to something else.
yeah,
So
absolutely.
I have a related question. You embody social justice. That is one of the things I love about you most.
Thank you.
And so I know that part of your story with this is very social justice oriented. So I wanted to talk to you more about that with your concerns about these attitudes and the impact then on clients.
Yeah, absolutely, because it has a huge impact on clients, right? I'm so glad that for myself, with the couple of clients that I identified who had DID, they were relatively new. And so I didn't have a huge amount of time working with them to possibly do harm inadvertently by not knowing and by trying to fit them into a box that they didn't fit into. But we do a lot of harm. I mean, the stats are really terrifying of people having to be in therapy for a good 7 to 10 years before they are accurately diagnosed as having a dissociative disorder. And the suffering that they have to go through during that time when, I mean, the work is hard and it's going to take time anyway, but if we can cut that out by actually helping clinicians recognize and treat or refer out if they don't feel comfortable, like that, we owe it to our clients. We owe it to survivors. I mean, because that's really who we're working with are some of the people who've gone through some of the absolute worst. And it aggravates me that, people are not willing to own up to their lack of knowledge or, these recognize these kind of social constraints and just be like, okay, yeah, I want to learn. Let's make a difference. Let's make this better because I don't know what the holdup is there, but it fires me up to both educate other clinicians about, hey, no, this is real, and we really need to educate ourselves further on how to recognize it and treat it. But just educating clients out there. That's why I'm pretty passionate about in my social media, just making sure that people know that these are things that they might experience and that there's a name for it and we can help them, because a lot of my clients these days are starting to recognize and kind of have something come to mind from social media because that's where a lot of people are talking about it. I mean, of course there's constraints and issues there too, but that's where a lot of our folks are finally getting their information and not from us mental health professionals. And why aren't we looking at that and doing something about it? You know?
Yeah, and then on top of that, I'm just thinking about the EMDR therapist world. So there's the psychology world in general, and then
Yes.
we have more recognition in, it's kind of included in every basic training that you need to screen for dissociative disorders because
Hmm.
you can break down dissociative barriers inadvertently with EMDR.
Yep.
But one of the things that I'm really passionate about, and you brought it up a bit earlier, is this idea of like, we need to know how to screen well, though. So, do you have thoughts specifically about this idea of just starting with the idea of knowing how to appropriately assess for and screen for dissociative disorders?
So I think my main concern about screening is really that we get enough information to make a real nuanced decision about kind of what's going on with clients. And regardless of I have strong feelings about the screening tools. I definitely prefer the mid over the DES, but more than anything else, it's about how do we follow up and have a conversation and help like our consultees or other clinicians understand that we really have to dig further in. It's not just, okay, they scored a 7 on this and just accepted it at face value, but knowing the questions to ask for, okay, what does that look like for you? Can you give me some examples of what that looks like so we have a sense of, okay, did they get what the question was after? Does it feel more psychotic versus does it feel more dissociative? And I go into a lot of detail on kind of how to differentiate the two in my training, but that's a big piece is being able to ask the further deeper questions so that we know. And it's not just a kind of a check mark, okay, they scored this and then I move on. That is not how we should be doing things.
I think a lot of our listeners will have had a range of experience with their training, and for
Sure.
some, they may very well have just come through basic training, were given the DES, and really nothing further, no real explanation of how to do those follow-up questions.
Yeah.
And some trainings definitely go into that in more depth, but a lot don't. And at least I've experienced that as I've had consultees over the years, that there's really a range, but the range really tends to be on the lesser, not the more side. Um, and so
Uh-huh.
let's talk about your process of realizing I need more training in this, what that was like, and how that evolved into the training you created. Because I
Sure.
think it really follows from this piece of what the experience is just starting out as an EMDR therapist and figuring you need to learn some stuff.
Yeah, absolutely. And so, fortunately, I had you as my consultant well, because you knew you had experience in working with dissociation. And as we kind of mentioned briefly, I kind of dove into the deep end from the very beginning of these really complex, complicated folks. And so having someone that you can rely on to help walk you through as you're learning, because that's super important because if I wanted, and I did, I was like, this is fascinating. I want to deep dive. This is a passion of mine. But in order to do that, I had to read the book that was like this thick with a lot of good information. I went to a 5-day intensive program with some of the leads in the field. It was never less than like a 3-day commitment training, and those were expensive and they often involved travel, and then other than that it was read these really thick textbooks. And it was, I loved it and I threw myself into it. But if I hadn't had you to also be walking me through, I don't know how I would have felt competent to just kind of start in the beginning until I had gotten through, months of training. And that really was a piece of why I put the training together. It's something that I wish I would have had. It's by no means comprehensive, but it's a really broad foundation. So you feel like, okay, I at least have some skills, some language, some tools to start the work as I continue to grow and learn, which is what I would have wanted for myself. Because it's a lot. It is a big, deep, complex field, and there is a lot to learn. And so, yeah, I just kind of want to acknowledge that.
Yeah, I mean, I remember like, this was prior to me being able to sit with you and have anything to say about it, buying a whole host of books. And then I have this very distinct memory of having multiple books open in front of me and crying because I was like, this makes no sense. And it is so important. And yet it just feels like it's in a different language that I don't know. And,
Yeah.
and later on in my process of doing training and then consultation simultaneously, which I think is a really good point that that's probably the best way to learn this is with a both and. But that's where I was able to have someone really spell out, oh, these books contradict each other because this is this model, this is this approach versus this approach versus this approach. And so to learn the language of each of the different approaches and then also be able to take in the trainings differently because I had that person really translating it for me. So
Yeah.
I think that what you're hitting on is a really good point that this, you've created this introductory training that I think is a really great, like foundational learning that is, it's a textbook that you can actually understand, but it's in a training form and has clinical videos and things like that. But also this idea of, and obviously I would suggest they take it up on with you, but I think it's a really good idea for people to realize that sometimes just absorbing the information with a topic of this nature isn't enough. They really need to be having someone they've consulted with. And so this isn't about, oh, I'm certified, therefore I don't need to do any further consultation. It's like I learned this, most of it after I was a consultant,
Mhm.
because I just needed to learn it. So
Mhm.
I'm just really thankful for your training as well as that you are a resource for folks. So when you are working with people in consultation, kind of what is that like? If they're going through your training, but they're also in consultation with you, what, yeah, what is that like?
It's For me, it's exciting. It energizes me in the same way that I get energized, honestly, when I'm working with my DID clients and finally helping them have a language to talk about what they're experiencing. And so it's exciting and it's energizing to have, see light bulbs go off in a consultee's mind about kind of what they are seeing and oh, like this is what it looks like in front of me more than just kind of compared to what I thought it would look like when I read this book, right? And it's validating because we all have stumbled along through the process. It's so different in how we have to apply EMDR and reprocessing and bilateral when doing this work. It's super different and you really need to know, you know, where to be cautious and
Yeah.
where you can lean into your kind of more traditional training and understanding.
It sounds like it goes, and at least this was my experience, and it sounds like it's yours. It goes from this place of this is really frightening because these are types of symptoms or presentations I've never seen before or encountered before, and I don't know what to do, or I might have stepped in it and something went sideways. Um,
Hmm.
but then it turns into, oh, this is what this is. It's not scary anymore. It just wasn't something I understood before. And there's something I can do with this that's really powerful, really healing. And I can walk someone who's gone through terrible trauma. So their brain did really sophisticated things with it
Yeah,
and learn to dance with that and help them thrive, not just heal, but really, really thrive.
yeah, yeah. It's yeah, it's such an honor to like get to see clients go through that and experience that. And same thing with the consultees. It's so just amazing to see them grow through it. And it's exciting to me that we have then one more, person in the field who knows what they're doing and can be an advocate and kind of help continue to provide that education to clients and colleagues alike, because I think that's the way we're going to have to negotiate this change in our culture.
Yeah. So let's talk about how people can get in touch with you and also the course. So the course is on the precisionemdr.com website in the advanced training library. You can find it under the drop-down menu, the dissociation course.
Yes.
And then Colette, so you are on social media, you're also your website, all of that. What is all that information? And we'll share it in the notes as well.
Sure, absolutely. So my website is www.colettelordphd.com. So that's where you can find me and send me a secure message if you are looking for either, therapy or consultation. And then you can find me. I'm on both Instagram and Facebook, but I am much more plugged into Instagram. So if you are looking for me, you can find me at Trauma Therapy SD, as in San Diego, there. And I try to share a lot of just useful information. And then of course, like everyone, I have in the links in my bio, you can click and go directly to the training. Or you can again message me if you're interested in getting consultation or any of that kind of stuff. And then if you want my email, it's me at ColetteLordPhD.com. So
Perfect. So
I'm, any of the ways, please reach out. I would love, yeah, I love talking about this stuff and helping people. So
and the consultation you offer, I know this because we do it together. You
yes,
do facilitation for our basic trainings. And so you're someone who people can choose as their consultant to take them through basic training because
yes.
we pair up people in small groups rather than large and sort of like you get who you get groups.
Mhm.
And so people can request you as their consultant for that. They can do certification with you consultation towards becoming a consultant. Can they also just do one-off consultation with you about this topic?
Yes, they can. I've certainly done that a number of times. Uh, And sometimes it's about helping people figure out whether or not this is, going on and whether or not it's something they feel they want to dive in to knowing what to do with if it is something that they're seeing. But yeah, I do that fairly frequently as well, the kind of the one-offs. And then of course I will give you my advice on if I think you need to be good getting ongoing. But that's always the clinician's choice.
Yeah, so it can be something where it's like, I just have a case that I'm really confused on, and I don't necessarily have the adequate training and experience. So I need expert eyes kind of to help me see what's going on.
Yep.
And that can lead to either, okay, that clinician's going to dive in and get more consultation and training, or you're going to be kind of suggesting that if that's not what they're interested in, this would be a case that they should refer out. So it
Yes.
doesn't mean they're committing to becoming an expert in dissociative disorders. It can
No.
mean sort of a discernment process in a
Yep.
sense.
Yeah,
Okay.
exactly.
Okay. Well, I am really grateful for your time today and for having this conversation and that you are a part of our team because your everything that you bring to it, your heart, your soul, and your intellect and your expertise are all hugely valuable. So thank you. And I very much hope people are in touch with you and take advantage of the training that you have created because it is excellent and so valuable. So thank you.
Thank you so much for having me. I really appreciate it.